Good afternoon. Good afternoon. Welcome to today's Wisconsin Health News virtual event on the state of family care. Thank you all for tuning in today. My name is Tim Stum. I'm the editor of Wisconsin Health News. We have a really great panel today lined up to talk about this very important topic. I am thrilled to introduce Lisa Davidson, CEO of the Disability Service Provider Network, Patti Jo Becker, co-chair of the Survival Coalition of Wisconsin Disability Organizations, Jamie Kuhn, the state's Medicaid director, Mark Hilliker, CEO of Inclusa, Sarah Mulbauer, CEO of Lakeland Care, and Kenneth Munson, CEO of Community Care, and Sean Kirkby, senior editor of Wisconsin Health News, who will be moderating today's event. Before we get started, I want to make sure we thank our very generous sponsors of the Wisconsin Health News virtual series. We view these events as an extension of the journalism that we produce in our daily email newsletter. And these important discussions truly would not be possible without their very generous support. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gunderson Health System, Hush Blackwell, and Quartz. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Aurora Healthcare, today's featured sponsor. We are really grateful for all of their very generous and continued support of Wisconsin Health News. And here to say a few words today is Sarah Becker, who leads Aurora Healthcare's discharge planning for Wisconsin and works with family care CBOs. Sarah.
On behalf of Aurora Healthcare, thank you to WHN for allowing us to be part of this informational series. Having worked in hospital social work for over 30 years now, I have a real appreciation for the family care program. Early in my career, when a patient's family could no longer meet the needs of their loved one, the patient most often needed to be placed in an institutional facility. Now, through family care, it's possible for many of those same patients to return home or to a home-like setting in their community with the additional supports available through the membership MCO. Our challenge is that the general public is often unaware of the family care program until they experience a significant change in their health status. So together with our partners from the Department of Health Services, Wisconsin Hospital Association, Family Care Managed Care Organizations, and the major healthcare systems in the state, we are searching for improved efficiencies in getting those people who are eligible for family care transitioned onto the program so that their care can be delivered in the most efficient and compassionate setting appropriate to their needs. Thank you again.
Well, thank you, Sarah. And thanks again to Aurora Healthcare for all of the really generous support. And with that, I'm going to hand it over to Sean to lead today's discussion. Thanks, Sean.
Thanks, Tim. Just to kind of open things up a little bit, as background, family care is a Medicaid long-term care program that serves around 58,000 Wisconsinites. It's in a state of flux right now. In the last few months, national for-profit health insurers have acquired two of the nonprofit managed care organizations that administer the program. Meanwhile, providers are pushing to overhaul the way they're paid, and health officials are working to update family care and preparing to ask state and federal policymakers to renew it for another 5 years. As a backdrop to all of this, the state's labor shortage is hitting the long-term care industry particularly hard, posing hurdles for people to get the care that they need. This panel is going to take a deep dive into the program, its challenges, and its future. We have folks across the spectrum, including the state's Medicaid director, an advocate for program members, provider association, and three out of the four managed care organizations serving the program. Molina Healthcare, which is the fourth and acquired My Choice Wisconsin to start a month, declined to participate. So my first sort of question is, we're seeing a severe workforce shortages in this field. Lisa, what impact has this had on long-term care providers, and what are some of the solutions that you see, or some of the causes too of these shortages?
Sure. Well, first of all, thank you, Sean and Tim, for hosting the discussion today. I'm really happy to be here and to hear that there's so much interest in this topic today. So, really our long-term care workforce is at a tipping point. We have gone through COVID and we thought that might have been the worst of the worst, but what we're seeing right now is even more challenging. Having an adequate workforce is really all about access to services and the quality of life for our most vulnerable. Our members at the Disability Service Provider Network are doing everything that they can within their ability to compete with other employers. But, there are some positions that simply cannot be remote. And some of our members, due to low reimbursement, they're really just not able to compete with the generous benefit packages that are out there. We've even seen leadership of some of our organizations helping out with staffing shortages by working on the weekends and the evening. But unfortunately, that's just going to continue the cycle and contribute to burnout. So we're seeing a lot in terms of the connection between vacancies and disruptions in care. We have facilities that have closed around the state for a variety of reasons. And then to maintain services for people in family care, those eligible people need to travel distances so that they can then have services. And that's very disruptive. They are losing the caregivers that they have become accustomed to. They're moving far away from family members and loved ones. And so that can be very traumatic. And so we don't want to see that happen. We know that there are providers out there that are not accepting referrals. And if providers do accept referrals, we see some are on the waiting list because we know that they need to staff up so that they can add additional capacity. So I would say that it continues to be very challenging. And in my 3-year tenure, it really is the most challenging at this particular moment right now. So I look forward to talking a little bit more about some of those solutions with you.
And can you just elaborate a little bit more on what you sort of see as solutions to this issue right now?
Absolutely. So, it's a multifaceted problem. And so there's not going to be one magic bullet to solve this problem. What we really need is we need to have people like are gathered today, not just the panel, but the broader stakeholders that are interested and invested in the program. We need to have an all hands on deck, response because things are so urgent right now. And it really is a time to have discussions, to be creative and have all options on the table. We've had tremendous support from Governor Evers and the legislature with increases to the Direct Care Workforce Fund. But there's other ways of addressing the problem so that we have the capacity that we need. I think one of the biggest things that we can do in terms of a solution is really address the disparity between what providers are paid and what it actually costs to deliver services. We need to make sure that we're making careers in long-term care attractive. We need to professionalize the role of the direct care service professional. And we really need to take a hard look at the role of the regulatory burden and ensure that we are not creating more and more burden that has people take a look at all of the reporting required and decide that that's not what they want to do, because they'll be spending a lot of time doing that versus providing that hands-on care. And so while the Direct Care Workforce Fund has been a very important tool, we actually have seen that the recent rate increases funded through the American Rescue Plan Act had an even greater impact. So all of that taken together, I think, kind of leads us to the next step, which would be updating the way that providers are paid in family care.
Patti, Joe, Lisa mentioned the return of some waiting list. Program advocates and the state and stakeholders spent a long time trying to make sure that waiting lists were eliminated for this program. Are they kind of back now? And how is this shortage affecting program members?
So the simple answer to are people waiting is yes, right? People are waiting in Wisconsin for services if they are using Medicaid long-term care in the managed care system, if they are families looking to access children's long-term support services. The wait has moved. I sometimes say we've come inside and now we're at the hostess station, right? We're host station. We've made it into the restaurant. We have a really robust system in Wisconsin that provides a variety of options for people to live in their own communities and in their homes and to have access to supports in, as we say, the least restrictive environment. But the sustainability of those and the implementation of those services and those waivers is dependent upon a provider network and that to be sustainable. So what we've got now is waiting. To Lisa's point, people and providers are creating waiting lists. People are saying no. I can say that I also work at a provider agency, and we know that it's not from a lack of managed care organization staff trying to find resources for people. It's just that we don't have the capacity within the provider network to grow our businesses at the current funded rates for Medicaid for these services.
What do you sort of see as solutions?
There's lots of solutions. And I think, and one of the things that I wanted to say through the theme of it all is this conversation, right? The interest that people are taking. The solution is that people pay attention. The advent of family care in Wisconsin took away, in some ways, the opportunity for people to engage locally with the organizations that, or the county member, the policymakers. So if we go back to pre-family care, counties were administering these programs. It was easy for me to call my county board supervisor when I had a need and for them to have a direct impact on sort of what the shared revenue spend would be, or if there was going to be, tax levy money and such to support the community systems. The transition to family care provided in the beginning, right? And dare I say, two of the legacy managed care organizations are here for those local connections to happen. So what needs to happen is local input and access to be able to get to decision makers. But then moreover, as Lisa said, the reality is for people to understand that there is a reimbursement rate that is less than the cost to provide services. Advocates are concerned that that will drive even more providers out of the market, providing us with less choice. And if we look historically at other situations that are Medicaid funded services with limited choice, advocates and stakeholders have not had great quality experiences with those types of contracts. So we need to monitor what we're doing. We need to help people understand that this is a necessary healthcare. Long-term care is a necessary community-based healthcare option that will draw the professionalism to the direct workers. And moreover, I'll say we need to raise the social value of the work done by direct care workers in our systems.
Thanks, Patti Jo. So Jamie, providers have and advocates have talked about some of these inadequate reimbursement rates that they don't cover the full cost of care for Medicaid patients, and that's posing a challenge to recruiting and retaining staff. Kind of what is your response? What is Medicaid doing to kind of help address this workforce crisis?
Yeah, thanks, Sean. Thanks for having me, and thanks everyone else for participating. First, I just want to start out with saying that obviously all of us share the same value, which is that we want to make sure that our family members and friends are being serviced in the communities or in their homes so that they can continue to be participating members of their local communities. And I think we at DHS, along with all of the panelists here and many others, do certainly take seriously our workforce challenges. I think one of the things, and I think Lisa said this, and Sarah might have said this at the top, is really that this is a partnership. No one of us, no one entity in the space controls all the levers of this program. And so we're really grateful for those partnerships. We also know that there is always ways to enhance our communication and our collaboration in this space. And that is one of the features of how we work through the workforce shortage. I would say that this shortage in this industry certainly didn't just happen as a result of COVID. It was certainly already on the brink. And I think to everyone's point, that one of the places that we start in this space is by, again, collaborating, and we all have different areas in which we can have influence. And while the Department of Health Services inherently is not the space for certainly dealing with the overall workforce shortage, and particularly this, we are coming up with and we are enacting solutions We certainly have taken the opportunity during the public health emergency to utilize American Rescue Plan dollars to implement a very bold home and community-based services program and new initiatives. One of the things that we are able to do is expand upon our WIS Caregivers career program, which was originally created to help partner and train certified nursing assistants. And in this space, we have added and enhanced that program to include direct care providers. And so what we're doing with that program is, again, to everyone's point, it's about professionalizing this group of workers who are dedicated and compassionate individuals that we all want to see serving our family members and friends. It gives them the ability to go through training, online training and credentialing to help professionalize them. It also provides incentives for recruitment and retention. And along with that, working in the platform, which is WIS Caregivers Connections, is connecting those workers with employers. So we have to have all of those pieces. And we were really fortunate with these dollars to be able to do that. And that's just one of the spaces. I know that we've also, and we'll probably get into this more as well, but again, in that initiative, which the governor has been extremely supportive and looking for across the board, even with the Department of Workforce Development and WEDC in this workforce shortage challenge, is making sure that we also have funding for grants. And what we've seen in those home and community-based service grants is a lot of entities doing some really innovative work in this space to help encourage and recruit in the workforce. We've had examples where individuals are working to, in one of the examples, that grant has been able to provide an opportunity for providers to work a 4-day work week while getting paid for 5. And what they've seen as a result of that is provider satisfaction, member satisfaction, to give them days for rest, but also to work out schedules and, again, encourage more individuals to get into this profession, which is desperately needed, as we know that family care numbers will increase as we move into the future. And we want to make sure that people understand that this is a profession that is highly regarded, highly valued, and the department, along with everyone else, supports our providers getting paid what they are worth.
Thanks, Jamie. Sarah, I was wondering if you could talk a little bit about what are MCO's role in addressing the workforce shortages? Are there steps that Lakeland has taken to address these challenges?
Yeah, thanks, Sean, for the invitation for today and hosting this. I think for managed care organizations, and in particular Lakeland Care, we have recognized the importance of needing to increase support to our providers. Actually, part of our business plan this year was to reinvest in our providers, and we were able to do that with supported home care, with our transportation, and with some of our residential providers as well. Just because we really know that there is a crunch to find caregiving or caregivers, and we want to make sure that our members have access to high quality services, that they aren't having to wait to be able to access those services, because oftentimes when that happens and you end up in a worse place than where you started, so you have a lot more work to be able to catch back up. I think the DHS has also given some additional funding through that ARPA dollars to be able to pass through to our providers. And I think that has been instrumental as well. When we have been able to increase rates for our providers, they're telling us that it's saving them for now, but it's with that little caveat of for now. So it's like, what do we need to do to carry that forth into the future?
And I guess to follow up on that, what do you think needs to be done to carry that forward into the future?
Additional funding into the model to be able to really, to stand up on it. I think Medicaid, honestly, has always been that underfunded piece. There's a lot of struggle in trying to understand why we need to increase more funding into the Medicaid program. And because of that, I think we have just fallen significantly behind in where where maybe other states are when it comes to that funding component. And we don't see this just in this program as well. We see it in Medicaid services, even in the healthcare side. We're seeing in our rural areas that providers are no longer doing specialty services or having to close a hospital. And so this is not just a family care Medicaid issue. It's a Medicaid issue across the board.
Thanks, Sarah. Kenneth, what is community care kind of doing to address this crisis? And what do you sort of see as solutions to workforce shortages?
Well, at the end of the line here, so I can repeat a lot of things others have said, but let me start with community care specifically, because the workforce shortages are in different places at different times, worse and better. So part of it is to figure out, where the most difficult challenges are. So, for example, we have found over the last few years, that some of the placements where we have people who have a high level of need and need maybe 2-on-1 or more, that there's more turnover in those situations. So you have a case where we have providers at 2-bed or 4 beds who can't keep employees and can't keep employees who are qualified to serve, or who just get frustrated. So we had implemented doing some provider support through bringing in a consultant, doing some trauma-informed care support, trying to help those providers. And I say to you, these are small providers, what we generally call mom and pop providers, to try to give them support to have that stable workforce so that those folks can stay with that employer, even as we see some very, very challenging situations come their way. So, that's something that we've been doing. But the bottom line is the things that DHS and the state have done, the governor and the legislature have done in terms of the additional increased rates for the ARPA dollars, the career ladder work, again, through ARPA, and the direct care workforce dollars, especially. Money is not the only thing, but it's a very important thing. I had a meeting at DHS last week, and I came back and stopped at Quick Trip in Johnson Creek. And there was a sign in Quick Trip that said $17 an hour for a weekend evening differential. That is more than a lot of our caregivers are paid now. So the money issue is a big, big issue. And then the other things as well, the career ladder and other things. So there's a lot going on. I think Lisa started off with, there is no magic bullet. There is no one single issue. This occurred and began before the pandemic and has only gotten worse.
Thanks, Kenneth. Mark, wanted to circle to you. What are kind of your thoughts on this? What has Inclusa done to kind of help meet this workforce crisis?
Thanks, Sean, and thanks for the opportunity to be a part of the panel this morning, or this afternoon. Inclusa has really kind of taken a step back from this issue, and it's been so pervasive across the state that I think it takes a much broader set of thoughts and thinking and ideas across our stakeholder group, as many have mentioned, to really look at how we can come together to create solutions in a collaborative way. There's no doubt that this is a significant issue, probably one of the most significant issues we faced as a program in the state for quite some time, both with hiring and retaining direct care workers. Certainly has gotten a lot of attention. I think there's a real need to continue to promote solutions on that collective basis. And how can we come together in ways that really provide support for that solution finding? As our work in Inclusa has moved forward over the last few years, I think we really tried to look at a number of ways that we can collaborate with providers, with our advocate community, reaching out directly to members to find out where there are choke points in this process, so that we can have a better understanding of where the real need is and how we can apply collective solutions to those issues. We've also been I think aggressive in looking at how we can create pipelines for bringing people into the workforce. And I know as we have joined the Humana family, Humana has had a large focus on building that pipeline as well. We know that there's a shortage of nurses across the state, across the country for that matter. And looking at how Inclusa and Humana have partnerships with many colleges and universities to include internships and clinical rotations and those types of relationships with those universities and colleges for different types of positions really helps us, I think, as we're looking at how we can help people choose this as a career option. In 2019, Humana created the Humana Integrated Health System Sciences Institute at the University of Houston to really look at how they could disrupt the way that we train healthcare leaders of tomorrow, with a focus really on advancing population health, looking at improving health outcomes and expanding the use of value-based payment models. We've also partnered with Emory University to create Centerwell Home Health Lab, which stimulates home health visits for nursing students and so forth. So it's really about how we can help people look at this as a career rather than a job. And many people have already said that. But it means really providing our caregivers with room for growth and leadership development, programs for decreasing burnout, improving well-being, as well as career flexibility. I know that the burnout piece is a real thing, and that we need to do a better job of really looking at how we can provide support and maybe respite for caregivers in more flexible and comprehensive ways as we move forward in time. But again, we're very interested in being a part of the solution as a system, and as we look forward to future years and addressing this issue successfully.
Thanks, Mark. I wanted to switch a little bit. There's been some major movements and changes kind of in players in the family care space, including in the last few months, Humana, as Mark mentioned, has joined forces with Inclusa, and Molina Healthcare bought My Choice Wisconsin. This caused some concerns within the advocacy community as well as with program members. Patti, Joe, can you talk a little bit about what are those concerns and how are people feeling about these acquisitions?
Yeah, thank you. The concerns that advocates express are related to that idea of a larger company and the distance between the actual person receiving services and where decisions might be made related to how to implement services within those organizations. And that comes from a variety of things. We've identified already on this panel that the workforce crisis is not new, right? So individuals using services right now have experienced struggles related to that workforce. So they're coming from a lens of already being a little anxious about what the future brings based on those day-to-day experiences. So when we layer onto that a change in the model with maybe newer players, what they may anticipate to be fewer choices, people are concerned about quality, they're concerned about access. And I think what we really, and I know what we really appreciate is that advocates did reach out to the department, have expressed concerns, were heard, and really appreciate DHS's ability to open up the public forums and to take in and listen and respond to concerns that stakeholders, both providers and those using services and their families have. So that we have to recognize again that open door, that ability for people to be heard, for people to be listened to. Many of us on this panel, we've been around a while, right? And there was a time when, an advocate could wheel into the secretary's office at One West Wilson and share what they were thinking. We have to get back to that space for advocates, I think, to help them understand the change.
When it comes to this, there were some contract changes that were put in place for these deals. Have those addressed your all's concerns, or is there more you'd like to see to ensure quality care?
Advocates appreciate the updates to the contract related to measures of success, right? What are we doing to look at quality outcomes? How are we measuring that? And how are we being transparent about that? The reality is those contracts have not yet been signed and people have not lived in that space, right? So it's hard for me to say today, yes, they're all in, right? The reality is people are today experiencing a gap in services, some anxiousness about that. And sometimes that's hard to see impact, obviously, of contracts that have yet to be implemented. I do know there's comfort in the conversation and people having that space to talk about those things. Advocates, as I've said before, in Wisconsin, we've experienced limited choice with contracts for Medicaid funded services. In other spaces, non-emergency medical transportation, people have seen that related to the fiscal employer agents in the IRIS space have been purchased in different ways. And also what we'll see with this change, which I think still not necessarily directly a family care topic, but one of the entities that has acquired one of our managed care organizations will now have the same parent company will operate the IRA, the largest self-directed personal care agency in Wisconsin, as well as one of the largest IRIS consultant agencies. So again, there was concern from advocates at the beginning of these discussions, and those were shared with the department. It's comforting to see that some firewall language has been built into the contracts, but we have yet to see how that will be enforced and enacted. So again, open communication and dialogue is going to be the key. I also want to be really careful to not broad brush everybody, right? This is hard to do. Not everyone's in the room today, so I want to be respectful of that as well. I think the folks that are here are dedicated to making that community connection. They are familiar. They are, and this leadership and those decision makers are available and accessible and are focusing on building community and community connections, which is what will sustain all services regardless of what the system does.
Thanks, Patty Jo.
Mhm.
Mark, can you elaborate on why Humana and Inclusa joined forces and kind of what has been your reaction to some of the concerns that you all have heard about this deal?
Sure, thanks, Sean. I think a number of things that we can talk through as it relates to the acquisition of Inclusa's assets by Humana. I think in much the same way that Humana is working both on the local and national levels to address the workforce shortages, we're able to bring other best practices to Wisconsin, drawing on experience in other states and a long history in serving Medicaid populations. Also, there's a very strong history of supporting adult care capabilities through Humana's Medicare Advantage footprint and CenterWell Senior Health Care Services segment across the country. So there's a great deal of experience that comes along with this acquisition. And I think really provides opportunity for us to leverage that in interesting and positive ways. In addition of Inclusa, the opportunity to purchase the assets of Inclusa and broaden Humana's long-term care footprint in Wisconsin. Humana also has fully acquired eye care. And so with Inclusa, Humana now covers long-term care recipients in all Wisconsin counties. So that's a big thing for all of us, I think, in terms of being able to provide a consistent approach across the state. Humana has been in Wisconsin for many years. They're a large employer in the state with significant operations in Green Bay and Madison, Milwaukee area. Workforce of about 3,600 people here in the state. In fact, Humana's national insurance subsidiary, Humana Insurance Company, is also domiciled here in Wisconsin. So there's been a long history of Humana being in the state of Wisconsin, and I think really can leverage that as an opportunity. Ultimately, I think the combination of Inclusa and Humana unites the best capabilities of both of the organizations, along with a shared and longstanding commitment to the communities we serve to improve the quality of independent living for members. As Patty Jo mentioned, I think those community connections and those local connections are really important and will continue to be as we move forward in time. Humana is benefiting from Inclusa's 2 decades of experience here in the state managing long-term care services and supports. I think Inclusa benefits from Humana's innovative approaches to providing Medicaid benefits for over 1.3 million members under the Humana Healthy Horizons brand. So I think benefits both ways through this acquisition. Together, we have the expertise and the resources to not only continue to deliver excellent whole person care to members, but also to remain strong partners in our communities. And those values align very strongly across the organizations. And I think it was one of the most compelling parts of bringing the two companies together. In order to ensure that all members and providers, associations, communities continue to be well served, we've created a joint eye care Humana Inclusa Advisory Committee to provide guidance to the organization as it moves through the transition and integration process. The advisory committee is comprised of members, representatives from external advocacy organizations, providers, and provider associations. to ensure that we provide continuity to providers, the community, and to the members that are being served by Inclusa.
Oh, sorry.
I'll just add that the proceeds from the transaction will fund an initial endowment for the Inclusa Foundation. And I think that's really an exciting thing because the foundation will be able to continue to look at how to enhance health of Wisconsinites across the state. And their work will really focus on intentions to provide grant funding to support innovation in the long-term care system in Wisconsin.
Got it. Thanks, Mark. I'm kind of curious. So, Humana is a for-profit company. How does it plan to generate a profit while ensuring members get the services they need? I mean, given, some of the thin margins we see in the space for Medicaid operators.
Well, that's true. Humana is a for-profit company. I think the objective with Humana in this Medicaid long-term care space is to look at the margins that are available within the market, just like we have over time as managed care organizations here. And I think as we look at historically, that's been a 1 to 2% margin within the program. And so Humana's objective is not to have a large profit margin within the Medicaid long-term care program. Certainly some of the other products are able to do that. This is really a complementary approach to all the programs and products that are offered in the Humana family of products. And I think offers a way to enhance that through really comprehensive supports across the healthcare continuum.
Thanks. And one follow-up too, can you elaborate a little bit more on this new endowment that's been established? What's its size? What was the purchase price of Inclusa and how much went to that endowment?
Appreciate the question. We aren't disclosing the terms of the deal. What I can tell you is that the foundation will have a substantial amount of funds to really look at how they can provide support to innovation in the long-term care space. And they'll be looking at creating a grant program that will start in 2024. They're working on that right now. And I think there'll be really great opportunities to partner with providers and with advocates and others who are interested in supports within the long-term care system and how we can continue to support innovation there.
Thanks, Mark. I appreciate it. In terms of, so Kenneth, I kind of want to switch to you for a second. Can you talk about your reaction to these, the transaction, both for Inclusa and for My Choice Wisconsin? How does the organization plan to be able to compete with these larger companies now in the space?
Well, I guess my basic reaction is I was at the state more than 20 years ago when the family care was in pilot, and certainly was established with a network of regional nonprofits and resource centers. But I'm not surprised that things have changed. Over the whole country, the consolidation of long-term care and healthcare services, I can only say it's not a surprise. When I came to community care 10 years ago, there were 11 managed care organizations and I think 14 regions of service. And that now has become 4 managed care organizations, and the state is consolidating the 14 to 7. So the most accurate thing I can say is I'm not surprised by this. So our situation in community care is we came into existence long before family care in the 1970s with some basic goals to serve people, to serve and encourage and help and assist people being happy and healthy and having independent lives and living as long and as well as they possibly can. That hasn't changed. These procurements from the other organizations haven't changed the basic mission we have. So in the 10 years I've been in community care, we've had multiple conversations with insurers, with other MCOs, with health and hospital and health systems to really see how we can continue that mission. What's the best way for us to compete? This has been a big change, these acquisitions. It's changed the competitive landscape. So the basic issue for us is how do we continue to provide the services to accomplish our mission, and how do we compete to do that? So we're continuing to have those conversations with many other entities, including insurers, including health and hospital systems, including the other MCOs. And that's really where we are. trying to figure out and making sure that we can be around another 45 years to provide the services we provided. So my response basically is I'm not surprised by what's occurred, but our focus is on our mission, how we can continue to compete to provide those services.
So Kenneth, are you looking at, partnering with other sort of organizations in the same way that My Choice Wisconsin and Inclusa have in terms of, another acquisition or working with a national insurance company?
We have over the last 10 years looked at all of those things and will continue doing so, especially now because of the change in the competitive environment. So all of those things, as I said, other insurance companies, including nationals, regional insurance companies, health and hospital systems, and the other MCOs. To continue doing the work we're doing, we have to be open to any or all of that.
Got it. Thanks, Kenneth. Sarah, kind of what are your thoughts on these transactions in this space? Are you looking at, how is this going to impact Lakeland Care?
I think for us, really the premise of the family care program is about member choice, and it's not just about member choice with the provider, but it's also about member choice with the managed care organization that they're getting supports from. I think we also have in Wisconsin a very unique landscape when it comes to health insurance, where we have a regional model and we also have nationals in that place. So I still feel that there is a place for us as a state to be able to have that regional model, to be able to have that support, keeping local. That is something that is very important to us as part of our mission, vision, and values, is that we are in our communities so that our members are confident that we're able to understand what their community looks like and how to best be able to support them. And go ahead.
Oh, no, go ahead. Sorry.
I was just going to add, we too have had conversations with national plans, with local regional providers as well. Those are just conversations, I think, that are part of what we do and where the future continues to shift to.
When it comes to maintaining a regional kind of approach, what do you see as necessary either at the state level or actions that need to be taken by MCOs or other players to continue that kind of approach?
Well, I think just the biggest piece, I think, to that, Sean, I think is what I'm hearing you say, is just making sure that we do have that place, that we're not putting significant barriers in place that are going to preclude a regional plan from being able to successfully compete. I think that's the biggest piece that we just need to be mindful of.
Thank you, Sarah. Jamie, kind of want to loop you in here. What has the Medicaid program done to address some of the concerns that have been raised by advocates and program members about these transactions?
Yeah, thanks, Sean. I would say first and foremost, something that's really at the heart of everything that we're doing, right, is it's member focused. I think everybody has said that there are certain requirements that we all have and values that we all share that is at the heart of whether or not this is successful. And that is making sure that our members are first. As the payer of those services, we're not going to treat any plan or MCO differently than the other. We have the same requirements for all of them. And part of what we're going to have to do, obviously, is monitor this as we move forward. But I think one of the things that Mark touched on for me was really, as Mark and Ken both said, is as family care has, I would say, changed over the years. I think we are learning that regardless of who is at the helm of which plan, the most important thing is making sure that there is choice for our members as part of a fundamental feature of this program. But also that we can do this work, the acquisitions to me are a sign that we can do this work and do the right thing for our membership. So as we continue to, I don't want to say evolve, I would say more change in this space and what it looks like. I think one of the things that maybe we will be able to see from these acquisitions is this model of care working, and is it actually providing the integrative services that we demand for our family and friends. And I mean, there are several provisions, and we take very seriously the feedback that we received from the public, from our advocates, from our members. And I think one of the things that we heard and that we will continue to monitor is just really making sure that even if the plan doesn't originate in Wisconsin, that they really are working on behalf of Wisconsinites, that there is a certain amount of their staff who are in Wisconsin, that there are firewalls in place so that there aren't conflicts of interest, and that as they go through this transition, one of the most important things, and Mark touched on this as well, is really communication with the members, and that they are apprised. And this is something I think we all want to continue to do better at, but that our members are apprised and educated on the services and the benefits that they are eligible for. We know there are a lot of individuals who are in our programs that aren't even aware of all of the services and benefits. And that obviously is really significant, because that is how we make sure that our members are getting what they need. That is part of the reason for integrative care. And we need to be focused on making sure that no matter what happens with the MCO, the providers, that is at the forefront of what we are focused on. And so we will continue to monitor it. I look really forward, Mark, to hearing about it, and I'm sure the state would be glad to collaborate and share with you some lessons we learned in our innovative grant program to continue to really focus and make sure that these resources stay in home and community-based services. So we will continue to work with them, and we will continue to work with others to again take feedback from everyone. We have lots of individuals who work in this space who are always on call for having conversations about ways that we can improve. And we may not be able to do everything right away, but that is our goal.
Thanks, Jamie. Lisa, what are providers' reactions to these transactions?
I think, it's important that we not prejudge, what may or may not happen. And so, on behalf of DSPN, we've stayed neutral throughout this process. I think, as was mentioned earlier, continue to hear this theme of communication. So being able to communicate through the Department of Health Services, through the oversight they have, and also through the Insurance Commissioner's Office, and being able to share that feedback with them, representing the perspective of my members. I think it's really important to work together with the new entities so that we can maintain a strong provider network. And we've been able to do that. I feel very good about what we've been able to do so far with the Humana and iCare and Inclusa leaders. And that is something that we're also working on with Molina. At the end of the day, we may find that things are better with this new system. However, if after working with the MCOs and the department, and if we feel like there are problems that we're not able to resolve, then I think it's important that we go to the legislature and make them aware of concerns and what may be under their authority to do. But I know that one of the things that has happened, a concrete step, has been that formation of the advisory group by Humana. It has diverse membership on that to help guide through the transition. And I'm very happy that I have some DSPM members that will be part of that moving forward.
Got it. So there are a number of efforts underway at the state level to improve family care and make some changes to it, including, as has been mentioned by panelists, a series of projects funded by COVID-19 relief dollars, as well as work underway now to renew the program for an additional 5 years. Lisa, what would you like to see in terms of changes to the program, either from those efforts with the ARPA dollars or through the renewal process?
Sure. So, one of the key components of the ARPA HCBS plan was the establishment of a new fee schedule. So that has been really a key focus for DSPM because of the impact on members, and because it's such a core part of what we're seeing right now. When we talk about workforce, it's intricately linked to this issue of payment because of wages and benefits and all of that. So I would say that that's definitely something that we're going to continue to prioritize. And we've been working with the department and look forward to continuing that. I think it's really important, though, that any new rate system is an improvement over what we have currently and is sustainable. And so I'm really glad that the department has been engaging not only provider associations, but providers directly to hear from them and to look at some of these really complex issues. I would say some other things that we're really interested in that have been also funded through the plan are the innovation grants, some of the updates that we're seeing to the aging and disability resource centers. I think it's really important that those are adequately staffed and are robust, and that the staff there have the information, because that really is the entry point into the long-term care system, where you learn about what's accessible, available to you, and what your choices are. Plus, we're also very supportive and interested in the direct care professional credentialing program that the department is working with UW Green Bay on. So being able to do more to train and professionalize the work of the direct care professionals, and then connecting them to employers where they have vacancies. I think also too, looking towards the future of family care, there's a lot of opportunity to leverage technology in a way that respects the individual and their person-centered plan, but also provides some relief to our workforce. There's a lot out there right now that I think has a lot of potential. And so working with individuals, working with people that are in family care, staff, MCOs, the department, and making sure that we're all on the same page in terms of how we would use technology. I think that there's also a couple other opportunities to improve the program moving forward. And I would say to formally recognize community supported living. That is a model of delivering care that we know is very cost effective, and we're seeing that around the state. And so being able to do more to really codify that into family care. And then I would say last, another big issue is what we look at is employment support. So in particular, how we define competitive integrated employment for people with disabilities. And one of the really exciting developments we've seen over the past few years is the innovation and entrepreneurship that providers are adapting as they look towards the future, making sure that as providers are meeting needs in their communities through opening new businesses like an ice cream shop or a thrift shop that employ people of all abilities, that we're not precluding people from having that long-term care supports to help them be successful in those jobs just because they are working somewhere that's connected to a provider. So there's a lot of, I think, potential. I think there's a lot of excitement. I think the American Rescue Plan Act has really been helpful in propelling what I think have been ideas sitting on the sidelines perhaps for a couple of years, given us the resources to do that. And so I think we have a lot to learn from what's been funded. And given that DSPM was one of the grantees, I'm excited that we can be part of those conversations and look at what has been working, what can we bring to scale, and then what do we want to sustain, and look at how we can make sure that that's funded properly.
Thanks, Lisa. Patti Jo, what are your thoughts on this? What kind of changes would you like to see to the program?
So I think we're thinking about the next 5 years, right, and the waiver and what that's going to look like. The reinforcing the, I'm going to bring it back to community connections, right? The ability to have opportunities within the waiver for individuals at a person-centered level to have the nimbleness to create the meaningful lives and build a full life for them, right, for their supports and services. There are a lot of opportunities actually within the waiver right now based on its creation in Wisconsin being a leader in innovation related to community-based supports. And ensuring that people have access to the services they need to live at home and in their communities at all ages and all abilities. And comment on, Lisa's point about really strengthening how we recognize community supported living and what that looks like, so that individuals actually know how to ask for it. I think that's the other space we get at. What can we do within the waiver? Back, to Jamie's point of it, educating people about what the waiver is, what do you have access to, what can that look like? And then in some ways, again, like I've said, the waiver is the waiver is the waiver. It's lovely, it's beautiful. It's meant to waive all the, those dollars you would have institutionally to live in the community. We need to really recognize that about it as a state and as stakeholders. And then use, as I mentioned, sort of the MCO contract language and the follow-up on those guidelines that are put into contract to ensure that the operators and the deliverers of these services are following those Wisconsin values. It's important. I always have to mention, right? Wisconsin was one of the first states in the country to develop these waivers. As I maybe am coming down the hill of my career to a different space, I feel like it's important to remind people to look back at that. We don't want to lose that progress. For a long time, all states have looked to Wisconsin as a leader in that space. Advocates have moved here. Families have uprooted from one state to another to come to Wisconsin. At this very moment, I can wholeheartedly, I believe, guarantee that there's someone in Illinois thinking about moving over the border, because we get those calls. So let's not lose that reputation as a leader. I think the waiver has some structures now that are great, but we need to reinforce the ones that are providing opportunities for family and unpaid caregivers to be trained, for individual advocates to have access to the information they need, and as well to reinforce the ombudsman program whenever possible to ensure people have someone to partner with when they maybe don't have a family member as accessible or available to do that as someone else might.
Thanks, Patti Jo. Jamie, could you weigh in? What would you like to see as changes to the waiver going forward?
Thanks. So I did want to touch on one thing, because it's really important that Lisa was talking about in regard to sort of the rates and the minimum fee schedule. Right now, under current law, we certainly set rates, and under the law, we are not able to ensure that those rates gets passed on to providers. So one of the things that was in the governor's budget, which was to set a minimum fee, which is a tool for us. In the space that we're in currently, that tool would be to set the floor. And I know there's some concerns around it, but is really to set the floor for what is allowable and then work towards progress in that space. And so, and making sure that it stays updated on a regular basis. But right now we can't do that. And so we had put in the governor had put in the budget this minimum fee with funding. And again, that's a really important piece. We heard a lot about funding, right? We have the funding to set a minimum fee schedule right now. We just need the legislature to approve it. And so that's a really important tool that I think all of us are looking towards to start somewhere so we can continue to make progress. Right now, we don't have that, and we'd like to see that. And so I think all of the partners here have been having that conversation, and we again want to make sure that that was part of the initiatives that's going to move us forward in this space, and that's part of the whole family care program too, right? It really is an important piece to advancing from where we're at currently and ensuring that as family care moves into the future, we have that ability to do that. Along with, and I would say that there are particular ideas out there on the family care waiver that we like more than others. I think what we heard after having public hearings, soliciting input from, I think we got about 1,500 replies. We had several hundred people engage. Is really, again, member focused, but talking about transportation, are there other ways that we can ensure that there is transportation that individuals need? Are there other services that people need in the mental health space? Are there other connections and ways we can do this work so we're not solely dependent on direct care workers? And I think Lisa Lisa has talked to us about this and peer support and making sure that that is something that is available. And I think, again, to the integrated employment, are there ways in the waiver that we can ensure that individuals have access to some of these services and innovations that advance and make progress on the waiver as we currently stand into the future? Because as we know, one, there will be more people in this program, and there will be more people we all know in this program. And first and foremost, we want to make sure as the payer that individuals who are eligible are getting what they need. And so I think that's the priority for the waiver as we move forward, is making sure we are bringing innovative ideas into that waiver, take the opportunity that we have in front of us to ensure that there are benefits and services in this waiver that really move us forward. And in regard to the future, I think, again, we can probably talk about funding, but I think we need to make sure as a collective that the legislature also understands how important this funding is. This is not about the word that I think some people feel differently about, depending on what circles you are, about expansion. This is about necessity. We need to make sure there is funding on the table right now for us to do this work. And as the ARPA dollars go away, we need to ensure that we are continuing to move and bring the legislature along with us and educating them about there is funding on the table for us to do this for everyone in the state of Wisconsin that is eligible. And that's what's exciting to me, is that we don't have to just look back like we used to and say we don't have any funding. There's plenty of funding out there for us to put into these programs to make family care and all of our programs more robust in the future.
Thanks, Jamie. I know we're a little bit over time, but I want to make sure we could get to the MCOs on the panel on this question. So if folks need to sign off, feel free to. I was wondering though, Kenneth, just kind of shortly, what do you sort of see as changes you'd like to see to the program?
So, I mean, there have been multiple conversations with the MCOs, the managed care organizations in the state, and the conversations go between the waiver, between contract changes, between just general policy issues. So I can't just put them in one category, but a number of the things that have been recent conversations have been things, for example, we have an annual rate setting process now. If there's a way to have a 2-year or somehow a multi-year, and this is not just the state's decision, CMS is involved in that, but as we talk about things like investing in the future and trying to plan. So you don't want to increase a rate to a provider and then the next year has to go down. Or when Lisa talked about some technological issues, you have to invest in those things. So having, first off, a more a longer term possibility of rate setting could be helpful. Again, without the knowledge of whether that's even legal or possible, that's something we've talked about with the state. And inflationary adjustment tied to the consumer price index, which, same thing, provides some more stability, helps bring revenue down so that we can assist our providers who are facing inflation. And maybe the last thing I'd mention is, and again, this gets detailed and prosaic, but we have, I hate to call people outliers because everybody who's eligible for family care is eligible, and that's a good thing. In fact, that's a great thing. But we do have a subset of people who are extremely expensive to support, to the tune of thousands a day, where the revenue doesn't match up because they may need to have the assistance of 2 or 3 people constantly, but their needs are around behavioral issues or behavioral health issues, and the revenue doesn't follow that need. So for at least some part of the population, there's a mismatch between revenue and between the expense, and that can kind of distort the expenses or distort the stability of the family care program. So all those are things that the MCOs, the managed care organizations, have talked about with the state, with DHS, and we hope to continue those conversations. All those things could help the program as a whole.
Thanks, Kenneth. Mark, any thoughts? Anything to add?
I'd just echo Kenneth's comments, but I'd also add, I think anything that we can do to enhance flexibility within the waiver so that we're able to support innovation in ways that we haven't in the past, perhaps to look at creative solutions would be helpful. Also echo Lisa's discussion points around the technology pieces and how we were able to see how we were able to support people in different ways through the pandemic with some technological advances that weren't available before. And those things remain relevant today, even post-pandemic. So I think really looking at how we can do that would be helpful. And then I think just in closing, I would say there's a need for us to sort of revisit the vision for family care and what family care looks like in the next 5 to 10 years. We've largely accomplished our initial vision within this program. And I think it would be great for all of us as stakeholders to come back together again and have that conversation about where are we going next? What outcomes are we trying to achieve as a program as we go forward in time?
Thanks, Mark. Sarah, any final thoughts, anything you'd add to what folks have said?
Yeah, no, everything's pretty much been covered. So agree with what the thoughts are for the future.
God. Well, thanks so much for a great panel, a great discussion. I'm certain we could talk for a lot longer. And I appreciate folks staying on time a little bit afterwards. We're going to be having an event in the next few weeks featuring health insurers in the state in Milwaukee. So if you're interested in that, check out our website for more information. And once again, thanks all the panelists for joining us, and have a great day, everyone.
Thanks, Sean.
you.
Bye, everybody.
Thank you.
Thank you.
Take care.